Good afternoon. My name is Joe Doherty. I am the spokesman for the Utah Department of Public Safety and working with the state of Utah's COVID-19 response. Today is the press briefing for Tuesday, September 22nd, 2020. Today we will start with Dr. Angela Dunn, the state epidemiologist from the Utah Department of Health. She'll be followed by Governor Gary Herbert, and he'll be followed by Rich Saunders, who is the executive director for the Utah Department of Health. Dr. Dunn.
Good afternoon. So we now have a 7-day rolling average of new cases of 857. 1 week ago today, we were at 522. And our percent positive is now at 13.9%, up from 10.6% last week at this time. And we have seen cases increase across all adult age groups in the past 2 weeks. 15 to 24-year-olds still have the highest case rates, but they're not the only ones being impacted by this spike. And this is reflected in the increase of active COVID-19 hospitalizations across the state. Today, we have 161 individuals hospitalized due to COVID-19. Last week at this time, we had only 115. We are seeing a significant case growth in 12 of our 13 local health districts. And Utah County is continuing to be the main driver of this statewide increase. Cases in Utah County grew by 81% in the last week, and they accounted for 42% of our state's cases, despite only having 20% of the state's population. And the case rate in Utah County is 5.4 times greater than the rest of the state. Looking at specific areas in Utah County, Provo and Orem account for over 57% of Utah County's cases last week. And in some areas of those two cities, you are between 3 and 6 times more likely to have COVID-19 than the rest of the state. The percent positive in Utah County is 23%. If we remove Utah County's numbers from the state's numbers, the rest of the state is only at 10%. This indicates that there is a lot of COVID-19 spread in Utah County, and we're likely missing positive cases because individuals are not getting tested in Utah County. So I urge you, if you have any one of the 6 symptoms or have been a close contact to a confirmed COVID-19 case, you must go get tested. This is the only way we will know where the spread of COVID-19 is and be able to contain it and prevent unnecessary illness and deaths in our state. Thank you.
Thank you, Dr. Dunn. Let me just take a minute to introduce Rich Saunders to you. He's our Executive Director of the Utah Department of Health. He's part of our Unified Command. We've talked about this before, but I want to reiterate the process that we go through to decide on policy. We have a Unified Command that we've set up, shortly after the beginning of this pandemic, the middle part of April. It took the place of our COVID-19 task force, which still had roles to play in developing the plan that we in fact have implemented that guides us as far as what we will do when the respective locations of the state, the counties, the cities, etc. Again, the color coding that tells us about how much restriction to have or not to have is part of that plan that was developed by our COVID-19 task force with the input and help of many people. The Kem Gardner Institute, those in the private sector of business, our healthcare providers, hospital associations, etc. Well, as we meet together and have those discussions, I want people to know this is a number of people that get together. We had yesterday, for example, although we worked through the weekend, we had 40 people in the command center as we talked about what does the data tell us. As we did deep dive analysis, what's the data mean? Is it accurate? Is it factual? And what does it mean as far as the future goes? And those 40 people actually represent about another 150 people that, again, have a chain of command and ability to communicate and give input from all walks of life, scientists, data analysts, medical advisors, medical personnel, doctors, business community, teachers, education. I mean, all the factors that you'd want to have around the table to help us understand what the data means and what we should be doing as policy going forward. So the process is exhaustive. We spent a lot of time here this past weekend going over the numbers, and we've asked Rich Saunders to come here and give us kind of the outcome of that effort and that analysis. And so we welcome Rich Saunders to the podium right now.
Thank you, Governor, and thank you, Dr. Dunn. It's good to be with you. I was going to give a little report on the outcome of the discussions we've been having in recent days. My name is Rich Saunders, and I am the Interim Director of the Utah Department of Health and a member of the leadership of the Unified Command. As you know, throughout the COVID-19 pandemic, we've moved, the state has moved, and various areas of the state have moved from red to orange. And today, more than half of our counties are in a yellow restriction level, and 13 of the areas are in the restriction level of green, which is the lowest level of restriction. Yesterday, as the governor mentioned, we met with the Unified Command, an extended group with large representation, and this is an ongoing discussion over the last many days, and taking a rigorous review of data and the details of the pandemic that we're experiencing, and looking at all the tools the government has to influence the safety of the management of the COVID-19 spread. And we looked at all the tools to put them all on the table and tried to figure out what in the world to do with our circumstances. And you know, it's encouraging. We've done a tremendous job as a state throughout this pandemic, leading the nation in many ways. And we've got a little bit of a situation on our hands that we needed to address. We concluded that an immediate change needed to occur to some color restrictions in the most prudent, which would be the most prudent intervention for this time. We've always talked about our color-coded restrictions in terms of being a kind of a dial where we can, go slowly in one direction or quickly, or be more surgical in a small area, or go more broad in the color-coded restrictions. And until now, we've not had to increase the restriction level. And again, I'll say that again, until now, we haven't had to increase the restriction level of an area during the pandemic. And up until now also, as we evaluate how to make these decisions, we've used a little higher level of flexibility in adjusting the restriction levels. And at this point in the pandemic, given what we've learned, we've found it necessary to target specific areas with increases in restriction. And as we've clarified the criteria for moving between restriction levels. And we're going to make that criteria available to the public so that there's a little more transparency on how the decisions are made. And we review the following main indicators when making transitions between yellow and orange, for example. We use three main indicators. The first is case trends. We hear about it all the time, but that's not the only thing that we look at. It is an important indicator. And here's the criteria that we look at and that we will look at going forward. And you know, these things might be tweaked from time to time as we learn more, but as of today, this is the criteria that we use. To lower restrictions from orange to yellow, the case incident trend line must be stable or declining over a 14-day period. This should include no more than 3 days of increasing case rates, and the most recent 3 days must show a plateau or a decline. That's what we'll look at when we're looking at lowering restrictions from orange to yellow, for example, or from red to orange. We tighten restrictions, looking at this indicator, from, say, for example, yellow to orange, when we see a 14-day rolling average exceeding 35 new daily cases per 100,000 population. The second indicator that we look at very carefully is hospital utilization. We need to be very careful not to overwhelm the hospital systems so we can provide the best possible care to all who need the care. We analyze hospital utilization by state going forward, not necessarily by county. That's what we strive to do. This allows us to make decisions on statewide hospital capacity because that's how hospital capacity is managed on a statewide level. We tighten restrictions from yellow to orange, for example, when statewide ICU and non-ICU utilization are above 68%. And when we look at a projection over the next 21 days, we're not anticipating that it will exceed 68%. We project ahead because we know that increased cases will typically lead to increased hospitalization eventually. So finally, the third main indicator that we use is percent positivity. Tightening restrictions from yellow to orange, for example, occurs when the 7-day average percent positivity is greater than 20% for an area. We loosen restrictions when going from orange to green when there's a 7-day average percent positivity of less than 10%. And we loosen restrictions when going from to green when there is a 7-day average percent positivity of less than 5%. So these aren't the only indicators that we look at, but these are the main indicators, and there's a list of other indicators that we use when evaluating counties or smaller areas or larger areas for decisions pertaining to restriction level. For example, testing turnaround time. Are we able to keep up with the testing capacities, demands, and also how quickly we're able to reach positive cases and their close contacts. These are examples of other metrics that we use to determine what our situation is. And as Dr. Dunn indicated in her remarks, we're seeing movement in the wrong direction, and specifically in Utah County with regards to trends and percent positivity. Specifically, the Orem and Provo area are experiencing large spikes that warrant a change in our approach at this time. Therefore, on behalf of the Utah Department of Health and the Unified Command, I'm issuing a public health order to move Provo and Orem from yellow or low restriction to the orange or moderate restriction level. This change will be effective at 11:59 p.m. on Wednesday, September 23rd, 2020. We've had great conversations with elected officials of Utah County and the local health department, and we understand that they're also considering a county-wide mask mandate, and we're encouraged by that discussion because we know that wearing masks influence in a positive direction the spread of the virus. We think it's a good decision, and we support that decision. Our goal, collectively, is to get this section of Utah County back to orange as quickly as possible. So we have a strong relationship with Utah County, their county commission, their health department, and we look forward to working very carefully together with them to try to figure out how to change this so that we can return to yellow, but even more importantly, eventually to green. And I want to note that we're granting one exception related to the move to orange in these two areas of Utah County. We will allow team sports to continue, but with no spectators. The current guidelines of orange do not allow engagement of sports to occur, competitive sports. However, the team sports. However, with this exception, they will be able to continue, as I've stated, but with no spectators. And that measure is put in place so that we can help influence the spread in the right direction. We look forward to the future workings with Utah County and continuing to develop the strategies that will change the course in the right direction. We need the help of students. We need the help of the general community in all counties, but especially Utah County at this time. We're optimistic that we'll be able to get Provo and Orem back to yellow, hopefully very soon, and eventually to green. We're committed to working together to make this happen. And we will execute necessary public health interventions while causing minimal disruption to the economy. I want you to know without any misunderstanding that we're very conscientious of the economy and mental health and the general health of society. So when we make these decisions, we make them with much discussion, professional input, and careful consideration. We also need, and we're grateful to have recent increased engagement from the business community. We need them. We need them to be on board with us. The economic impact of overwhelming the hospital networks is far worse than the impact of the temporary restrictions that we put in place. And I will say that these are temporary, and the length of that temporary time is dependent upon all of us and our decisions. A manual for safely navigating the COVID-19 pandemic for businesses is available on the coronavirus.utah.gov/business. The news across Utah, however, sometimes we might perceive that it comes across as negative too much. We try to strike a careful balance of stating the facts so that people know where we are. And there's good news as well. And one of those pieces of good news is that there are 13 counties in green, and which is the lowest health restriction level that we can impose. And we're leading the nation in finding ways to return to normal life. It's exciting to see kids in school, families out and engaged in life, purchasing at stores, and trying to return to the normal habits of life. This is very encouraging. We encourage you to do it very wisely and using good judgment on physical distancing and wearing masks and the other hygiene protocol that just simply works. We're learning to live with the virus, and that's a good thing. We really rely on each of you to help us in this fight against the enemy. All of us in common against a common enemy, which is the virus and other ailments that might plague our society. We are careful and grateful in our partnership with local health officers. I want to state this. They work tirelessly in their departments, and their whole teams work tirelessly to work for your good. The data they provide is essential in determining our course of action, and their work is critical for the success of targeted interventions like the ones I've just announced. And I will say on a positive note to end, due to these positive trends that we're seeing up north, we're pleased to announce that Rich County will be moving to green, our minimum restriction level, effective tomorrow at 11:59 p.m. And this brings our total number of counties that are in green to 14. Thank you.
Thank you, Dr. Dunn and Director Saunders. We appreciate the work that you're doing and will continue to do. With the announcement by the Department of Health just taking place here, let me add, if I could, a postscript to the discussion of today. Certainly I recognize, I think we all recognize that these, for the first time since we've had this plan in place of how we were going to navigate through this pandemic and this coronavirus and the COVID-19 issue. This is the first time we've rolled backwards. We've talked in terms of when we instigated the plan and we adopted it, that this was not a switch approach. This was not turn it on and turn it off. This was in fact a dial. And we could dial up for less restrictions or dial it back if we needed more restrictions. We recognize that this is somewhat inconvenient. What takes place here certainly has an impact on the marketplace, so we are sensitive to that and we're concerned about it. But frankly, as you've heard the numbers given by our epidemiologists, as we come with the data and the science, the medical advice, the information that we've assimilated, intervention is needed. And so that's what's taking place here today. And I certainly believe a little pain now will be a lot better than a lot of pain later. So this is an inconvenience. We recognize it. And as you've heard from Director Saunders, we want to do everything we can with Utah County to get out of the orange and back to the yellow as soon as possible. We'll work with the local elected officials, the Utah County Health Department, the county commissioners and others that have that responsibility of the mainstream frontline local elected officials and Department of Health to find a pathway to get these numbers down and to move out of orange back into yellow. That will be our goal that we will work together with on to get that, in fact, to be the outcome here, hopefully sooner rather than later. Our concern, we see this explosion here in part of Utah County. We've been trying to be a little more, have a scalpel approach here as opposed to a shotgun approach. Intervention is needed to stop this fire outbreak of the virus in that location. And if we don't do it, the unfortunate outcome of that will be orange being the category for all of Utah County. And we don't want that to happen. As has been mentioned by Rich, we understand that the county commissioners, in conjunction with their health department at Utah County, are looking for ways, in fact, to have a pathway forward, and are talking about the possibility of a mask requirement. And we look forward to working with them and encourage the discussion to continue. The sooner the better. Again, we want to do everything we can to get Provo and Orem out of orange back into yellow. I'll just mention too, as we see, and I had a discussion with governors earlier today and yesterday with the vice president, not every state is approaching this the same way. And I guess we can all have people sit on the corner and Monday morning quarterback and say, this would have been better, that would have been better. Certainly, we've not been perfect in our approach here, but we've had pretty darn good outcomes. And if you look at Hawaii, which did a great job of protecting the people's health in Hawaii, but they've devastated the economy in doing so. We've taken the approach from the very beginning that the health of the people and the economic well-being of the economy are not mutually exclusive ideas, that we should find a way to balance this so we have optimal outcome. And again, the fact that we have a lower death rate here in the state of Utah, significantly lower than other states like New York, for example, gives us at least some encouragement that at least on the balance part, we're helping protect people's health and welfare, their lives, as we've said. We've also worked to help with their livelihoods. And on the call I was just on, we were mentioned by other governors of having the most healthy, diverse economy in America today, in spite of the pandemic, as an unemployment rate of now 4.1%. So at least on that aspect of trying to have a balanced approach, get optimal outcomes, we've had some success, and we appreciate all who've contributed to that. That's not just us on the government side, it's probably mostly people in the private sector, having good habits, following good protocols. The private sector stepping up. We have a lot of our businesses that are joining and taking the pledge, stay safe to stay open, and following protocols with their businesses, with their employees, with their customers, to make sure that it's a safe place to go and shop, eat, dine, those kinds of things that would be more normal for us to do in previous days before the pandemic. I understand it probably as much as anybody, that life under COVID-19 is a stressful situation. And the uncertainty, people are scared about the virus. We have differing degrees of demographics out there. Our older citizens, those who are more vulnerable to severe reaction to the COVID-19, are very concerned about what's going to happen. They don't want to be shut in. They want to get out and be involved with life just like what they've done in the past. And they're very concerned and somewhat scared. Our young people, again, they're not as susceptible to a visceral reaction to the COVID-19, probably taking it a little more lackadaisical, not quite as concerned. But all of us need to be concerned for all parts of our population. The spikes we see happening in Utah County pose real threat to both the lives of people and our economy. Hence the need to have some decisive, immediate action, which has been announced here today. One last point I should make. We know that we are learning as we go. We don't have all the information on what COVID-19 even does, other than we know it makes many people sick and some people die. We don't know really about the long-term impacts and effects it has on people. I know of people that have had the COVID-19 that still have not regain their sense of smell and taste. I know people have had the COVID-19 that still get winded walking up a flight of stairs, even 2 and 3 months later from when they had the COVID-19 and are now diagnosed as not having that coronavirus. Doctors that I've talked to over the weekend are talking about lung capacity, heart problems in the future that we don't know about. So certainly under the heading of better safe than sorry, we ought to avoid contracting as much as we can the COVID-19, certainly working towards finding optimal benefits of protecting people's health and the economy until such time as we get get a vaccine to protect us against the virus. We had an opportunity to talk to the FDA here just the other day, and they believe that by the end of the year we'll have a vaccine. Our own medical experts here in Utah, which we consult and really are our mainline advisors, we believe in the people here in Utah and their expertise more than anybody outside of our borders. But they believe maybe the first part of next year we'll have a vaccine. But we need to, in fact, do what we can to protect ourselves until that time comes and people have the opportunity to get an inoculation against the COVID-19. We trust our science and our public health guidance that we get here in the state of Utah, which is really what guides us. There is no other motivation here other than having good policy based on good science, good data, good medical advice from the experts here in Utah. And by the way, again, we all have the challenge of doing our part. And we know that some people are reluctant to tell others that, hey, I got sick, I had COVID-19. It's okay to get sick. It's not anybody's fault. We ought to try to protect ourselves as best we can, but there's no such thing as zero cases. There's no such thing as zero risk. We try to mitigate as best we can as we navigate through our society and do the things that we want to do as a community at large. It's okay to get sick, but it's not okay to put others at risk. So we ought to take on that responsibility of making sure that in our own personal behavior, that we don't, in fact, risk other people to get sick by our own risky behavior. Let me just conclude by saying this again. It's our fervent hope that with everybody's cooperation, again, we know we're asking for some sacrifice, inconvenience. This is a war against a coronavirus, a pandemic that's a little bit uncertain, but it's going to take the spirit of cooperation for all of us. We're going to work again to not put too fine a point on it with the Utah County Commission, Utah County Health Department, and others in Utah County to find a pathway to get them back to yellow just as soon as possible. I think mask wearing is certainly something that needs to be considered at certain scenarios and opportunities to, in fact, protect ourselves. We've had the study from BYU, 120 studies. We know that wearing of a mask does help. It's not a silver bullet solution. It just helps minimize the risk of us spreading it to somebody else. So as I mentioned last week, I wear the mask to protect you, you wear the mask to protect me, and if we do that, we're going to be able to have a successful outcome here. Let me just conclude by saying this is not about mandates. This is about communities coming together and we as citizens doing what needs to be done to slow the spread of the pandemic and the coronavirus. We have a shared responsibility. We all have a role to play. My role is no more important than your role. It's all of us working together. I expect the locals to do their part. Again, they're on the front lines. They have the responsibility elected by the people. And so the local elected officials with the local health department have a responsibility to develop a program and a policy going forward that's going to help protect the people's health and welfare as well as the economy. So we all play equally important roles in this fight against the coronavirus. I look forward to continuing to work together with you. Working together is the only way that we can achieve success on this fight over the coronavirus. So I thank you for everybody's efforts. What we've done heretofore, we've done a pretty good job. We can do better, and I look forward to the future with hope and optimism. With that, we'll open it up for any questions that you might have for us. We got the director still here and our epidemiologist, Dr. Dunn.
Yes, this is Jed Bowl from KSL TV. This is a question for Dr. Dunn, please. She mentioned that we had seen the hospitalizations go from 115 to 161 in a week. And Mr. Saunders had also mentioned that that was one of the three key metrics. Talk to us a little bit about your concern for that hospitalization number rising, and also talk a little bit about why that projection only shows that we're going to only rise 68%. It seems to me that with the 3 days that we had over 1,000 cases, that's going to be trouble for our hospitals.
Yeah, exactly. And so that's why we're taking action now to prevent more cases. So again, the spike that we're seeing is largely driven by 15 to 24-year-olds who we know have a lower risk of being hospitalized. But what we're starting to see is that spread into older populations that are at a higher risk of hospitalization. And that's why our hospitalization numbers are going up, which is a consideration when we are making our intervention decisions, such as moving a city or a jurisdiction from yellow to orange. So with regards to the 68%, that's hospital capacity. That's not an increase in actual individual cases, but we want to make sure that our hospitals have the capacity to care for both COVID and non-COVID patients. So we look at our hospital capacity holistically, and COVID is certainly part of that.
Let me just add, Jed, too, is I've had the opportunity the last few days to talk to a number of our medical experts, those involved with hospitals. And the concern is not the lack of bed space as much as it is the lack of personnel. And as we have this lagging indicator here, it's a concern. We don't know what it's going to be. Our crystal balls are not any better than anybody else's, but we have an educated trend here that causes us pause. And so, again, we started in the very beginning saying we don't want to have our healthcare system overwhelmed. We've seen that in New York and other places where they didn't take care of that. We're making sure that doesn't happen here in Utah.
Hello, do you hear me?
Yes.
Hi, this is Christina Flores with KUTV. You mentioned that Utah County is considering a mask mandate. How confident are you that they will impose one? And what would be the impact if they didn't do it, or if they did do it?
Well, I don't know what the success ratio is going to be. I just know that they've been working on it for a couple of days. I've talked to the chairman of the county commission, who's working with his colleagues. He's talked to other mayors in Utah County about what is the pathway forward. They recognize there's a problem, and then the question is what to do about it. Ignoring it's not is an option, but it's certainly not a good option. And so what do we do to, in fact, slow the spread? Face mask coverings, we know work. They're talking about doing that. Provo City has already passed, as you probably know, a mandate to have mask wearing in Provo City. And so they're just talking about it and they're considering it. They're actually having discussions with us on how an ordinance would look like, what it could do. There's probably a variety of ways, in fact, to have that to happen. And certainly they need to do it in a way that they can get support from the public as well as the other elected officials involved. And we're hopeful. I think that's a step in the right direction. I appreciate the fact that they're taking this seriously and looking for ways to slow the spread.
Governor.
Next question.
Governor, can you tell us when, do they have a deadline in Utah County for when they'll decide on a mask mandate?
There is no deadline. It's an ongoing discussion right now. Sooner the better for me. We will invite them to come and meet with us, or we'll go down and meet with them with the Utah County Health Department, working with the State Health Department, Rich Saunders and his people, our medical experts. We'll work with our attorneys as far as how you can draft an ordinance and what is a possibility that you could get passed. And so it'll be a collaborative effort. We understand how significantly important this is to our overall welfare of the state, with Utah County being a hub of economic activity. And so we want to have minimal impact negatively, and we want to get out of this as quick as we can. It'll be a collaborative effort.
Yeah, Governor, this is Ross Terrell from KUER. So Mayor Jenny Wilson of Salt Lake County, sent a letter to your office imploring you to imply a statewide mask mandate, saying, quote, we need you to move from request to requirement. You've also said a few times, people wearing a mask, that's on each individual U-Time. But what's your response to this letter and her asking for a statewide requirement?
Well, it'd been more impressive to me if she'd called me on the phone and talked to me about it, as opposed to releasing it to the press, which sounds like more of a political stunt. That being said, I've been very consistent in talking about the local responsibility on this. Again, nobody knows the demographics and the culture and the situation better than those who are in that community at large. And what we have in Wayne County and what we have here in Davis County are two different dynamics. And so I'm expecting the local government people to step up. We're happy to work with them on what they need to do, and we'll support them what they choose to do. But we've let the decision on compelling mask wearing to be done by the local officials. I'm not opposed to people wearing masks. I wear the mask all the time. I do it because it's the right thing to do. We don't have to be compelled by government to do the right thing, do we? I would hope not. I know this is an appeal to the good, better natures of our people of Utah, but I think we have good, better natures. And we find that people are wearing the mask more often, and we're moving in the right direction. So again, we'll work with the local government officials on any of our jurisdictions of our 29 counties and our 248 cities, and work with them as they make decisions which are in the best interest of the people they represent.
Got it. And also, Dr. Anthony Fauci recently said, there's a lot that the country and governments can learn from the Navajo Nation, how they've gotten this pandemic under control. Is there anything specific that you've seen on the nation done that you think the state could implement?
Well, what was one of the really great things that happened to the Navajo Nation, and President Nez is a friend of mine. I've known him for many years, even before he was president of the Navajo Nation, is that he looked to Utah and we went down and helped him. We took food and medicine down there, supplies, PPEs. We probably supplied more help to them than any other state, and they have less population in Utah than many other states, whether it be Arizona or New Mexico. And I appreciate the fact that they've had some improvement. It's a difficult issue down there, and they were at one time leading the nation in infection rates. So again, we've worked very closely with President Nez and the Navajo Nation. We're pleased to help our brothers and sisters there, and I'm grateful for the good outcomes that are happening. By the way, we've gone through a surge before ourselves. Think about, just a couple of months ago, we had a surge. We redoubled our efforts. We set goals, 400 or less cases per month. We watch hospitalization rates and all those factors that help inform us on policy, and we achieved that goal. I just look, this is another spike. How much of a trend it is, we don't know, but we want to nip it in the bud so it doesn't become a trend and doesn't expose the rest of the county to being classified in the orange category. That would be not good for the economy. And so acting preemptively here in some ways is an important part of what we're doing here today to make sure we do what's in the best interest of the people of Utah County and the Wasatch Front and the state at large.
Hi, Governor. Nick McGurk from ABC4. We'd seen reports from groups like Young Dumb out of BYU, and we've seen photos on social media of students gathering together in close proximity for high school homecoming events. Are there any specific groups that have stuck out to you or been super spreader events? And do you have a message for folks who are just frankly over masks and just want their lives to go back to normal?
Well, as I've mentioned before, we all have a shared responsibility if we're going to, in fact, be victorious over this pandemic. And again, the coronavirus is real. I've been to the ICUs of a number of hospitals. I've seen the devastation that happens to people. I see the devastation that happens to us as a society and are not able to associate how we've done in the past. And we need to work together to as soon as we can to defeat this pandemic. Now, as I mentioned earlier, there's no such thing as zero risk. And there's no such thing as people not catching the coronavirus. We're trying to get to a point where we have a vaccine that can inoculate us against this, and we hope that comes in the next few months. This is really a matter of us all working together and showing, I guess, respect for our fellow man by doing the things that we know will help us not share the virus if we happen to have it, and keep us from getting it if somebody else happens to have it. The protocols are simple. They're not asking much to do. Wear a mask when you can't social distance, wash your hands, have good hygiene. If you're sick, don't go to work, which, I mean, that seems like a no-brainer, right? But we still have people that go to work sick, and some of them that have the COVID-19. So just common sense actions is not asking too much of a sacrifice for all of us for the common good of the whole. So I hope that's going to happen. I believe it is happening, and it needs to happen more directly now in Utah County so we can stop this spike that's taking place to become a trend that we can't take care of.
Hi, Governor. It's Ben Winslow from Fox 13. Why not just move all of Utah County to orange, considering that, college students move around? And what is orange? What really is the big distinction between orange and yellow if, you're allowing sports, if businesses can largely operate as normal?
Well, gatherings are limited under orange as far as how many you can gather, 20 or 50, and in-house dining will be impacted to some extent, buffets. So there is some impact, which is negative, and we understand that. That's why we're so anxious to work with the local people to get us back to yellow. We're trying to use a surgical approach. We look at the data, and it informs us that these infections are coming out of Orem and Provo. Now, again, we think it's probably a lot of the student population and some off-campus activities, but it's probably not the only thing. And so using a surgical approach we think is better than using some kind of a shotgun approach. If we can nip the fire in the bud here so it doesn't spread, we're better off. Think in terms of a forest fire. If we see a fire going there, if we can go put that out right now with maybe an abundance of effort, that will keep it from spreading through the forest and impacting other parts of the forest. That's the same thing with Orem and Provo. We're doing good in the southern part of the county. We're doing better in the northern part of the county. So let's nip it in the bud in Orem and Provo and stop it from spreading. That's the attempt here. That's the effort, and that's why we're being very surgical.
Hi, Governor. It's Ashley Imlay with the Deseret News. As you've been asking people to wear masks kind of for months and asking local officials to implement their own mask mandates, but we're now seeing like our biggest surge and only a handful of cities and counties have still implemented them. Why not issue a statewide mask mandate, and what could it take to convince you to issue one? And could you also comment on Senator Henderson pushing for one too?
Okay, I'm going to have somebody help me because I didn't quite hear what she was saying with the reverberation. Okay, and there was a follow-up? Okay. Again, I've answered, I think, why not a countywide mandate on what we're doing today. A statewide mandate doesn't make a lot of sense to me because the one-size-fits-all mentality, which we see many times in Washington, D.C., works for a few, but not for the many. We have, as has been announced today, we have 13 or 14 counties that are green. Most of those are rural areas where social distancing is the norm. They don't have a lot of population, and so it's easier for them to, in fact, at least protect themselves in that regard. We don't have many cases in these locations, and so it would be overkill, I think, to, in fact, mandate statewide mask wearing for those areas. It will do no good. And so we're trying to be selective. We're doing that, I think, in a very balanced, approached way, and I think that's the good policy. Again, local people elected by their constituents know their demographics and their concerns and conditions better than anybody else. They should make that kind of decision rather than this kind of dictating from on high. We have the ability through our health department to do that, but I think good policy would require and ask for the local government people to step up and make those decisions with the help of the local health departments. And Senator Henderson, again, I think she's talking about having somebody who's gone through and had a very visceral reaction to COVID-19. She knows the seriousness of this issue. She's been on oxygen for 3 weeks. I'm sure she takes it real personal to say, you know what, masks work. And let's see what we can do to change people's behavior. Now, you can do it by the carrot approach I've heard expressed, really the good nature, the fact we have respect and concern about our neighbors. We should just do it because it's a right and better thing to do. But there's those that say, if you're not going to be doing it willingly, then maybe we need to have government compulsion. That may happen in the future. I'm not ready to pull that lever today.
Hey, Governor, this is Carter Poppy with the Times Independent in Moab. My question is about asymptomatic testing and the state's positive test rate. Since May, Utah's positive test rate has been above the 5% target that the CDC and World Health Organization have set. Our positive test rate on a rolling average has actually been above 8% for every day since the past 3.5 months. But as I understand it, we've expanded our testing capacity, so we could be doing a lot more testing than we currently are. So last week when the Tribune reported that the state was going to start making testing available to teachers regardless of symptoms, there are many people in Moab who received that positively. We've been trying to do asymptomatic testing since pretty much the beginning. So my question for you is just whether you're thinking of asymptomatic testing as a possible path forward on improving Utah's level of testing, and how do we have more people take tests? And I have a follow-up for Dr. Dunn.
Oh, thank you. Testing has been a big issue from the beginning, and we've had some successes at it. We've fallen short, I think, in some areas. We are resetting the goal to do more testing and make sure that people that have symptoms can be tested. I've mentioned the fact that we have the concern of those who are asymptomatic still have a viral load and are able to infect people. Maybe not as likely as those who have shown symptoms, but nevertheless, it's a concern of the spread. So testing is an issue, and maybe there's areas that we can do better. Dr. Dunn, why don't you come and talk about testing and what we can do to improve our testing in Utah?
Sure. Yeah, so your point is exactly right. I mean, our high percent positivity is definitely a concern, and that indicates that we have COVID-19 spread in Utah, and likely the higher your percent positive, the more likely you are to be missing people who have COVID-19 but are not yet diagnosed. So we understand that and are prioritizing expanding our testing capacity to those who have mild or asymptomatic symptoms or don't have symptoms at all. In case in point, just this past weekend and last week, we worked with UVU and USU, who were seeing spikes in their populations from a variety of data points to make sure that they have access to asymptomatic testing. And we're doing that for specific at-risk groups right now, and hope that in the future we will have the capacity to issue it more broadly. But right now we're really focused on people who are close contacts to confirmed cases. They should be able to get tested regardless of their symptoms, and then specific high-risk populations.
Thank you.
All right, 2 more questions.
Yes, this is Jacob Kloffenstein with KSL.com. Going along with testing, what is our current capacity for testing per day? I know last I heard, I think it was around 9,000. Is that still kind of the range?
I'll let Dr. Dunn answer that.
So there are a couple ways to look at capacity. One is how many tests can the labs in Utah actually run, or labs that we're contracted with, and that's at about 11,000 right now. So what we're really focused on is increasing our capacity to actually collect specimens. And so we need, more staffs, more mobile teams, and more of that infrastructure to be able to reach that number of tests per day. And then, of course, along with that comes the demand, which we right now really need people who have any one of the 6 symptoms or are a close contact to a confirmed case to actually go and get tested, because we're seeing that demand decrease as well.
Last question.
Hi, I wanted to, can you hear me okay?
Yes.
Okay, I wanted to kind of add to Ben's question about why only Orem and Provo. I know that you say that the bulk of the cases are coming out of there, but the criteria that was listed was they have to get under 35 new cases per 100,000 residents a day in order to switch out of orange. And according to the most recent local data, Provo and Orem aren't the only towns with rates that are higher than that. American Forks, Saratoga Springs, Alpine, Highlands, Cedar Hills, Linden, and Mapleton all had rates higher than 35, and Linden and Mapleton had even higher rates of new cases than Orem did per population. So I guess my question is, what good is restricting Provo and Orem when all of their similarly infected neighbors are going on as usual? I mean, there are reports that after the mask order in Provo, people were hopping to other towns and counties, in some cases specifically to dodge local orders. So, I mean, given the fluidity of this population in this county, and not just in Utah County, I mean, the whole Wasatch Front tends to be pretty interactive with each other and into southern Utah too. So what good is it going to do when the order change is limited so specifically to these two towns?
Well, as I mentioned, we're trying to take a very scalpeled, rifled approach as opposed to a shotgun approach. So we're going to the epicenter where the fire is starting and where we see this surge that's taking place and stopping it there. In the hope that
looking at your scalpel metaphor, isn't there some point where you're just scalpeling out half the cancer?
We're hopeful we're doing it in a way that gets rid of the cancer and doesn't kill the patient. We have an economic need in Utah County, and we're concerned about what that's going to have an impact on. As we've worked with the local elected officials, this seems to be more acceptable, certainly than a broad-based area where everybody's impacted negatively. So we're going to try this. That doesn't mean we can't make an adjustment going forward if we don't find this to be successful. But I think there's a willingness in Utah County to make sure that this does in fact work, and we'll put protocols in place that will allow it to be successful going forward. Again, we're working with the local elected officials, the Utah County Health Department. They're talking about some kind of a face covering requirement, which will help us, and I think we'll get there. So I feel good about the steps we're taking. I'd much rather do a more targeted approach as opposed to a blanket approach that probably has overkill. Okay. One question from the Daily Herald. Okay. The letter has. Daily Herald, question? They must have had their question answered. Well, let me just sum up then again. This is a challenging time for Utah County and particularly Orem and Provo. But there's reason to believe that we can get out of this in a relatively short period of time. I think the energy is there, certainly the desire of the elected officials, certainly the desire of the business community. And I hope that the constituents at large are going to say, what can I do to help us solve this problem, stem the pandemic surge, and make sure this is just a spike and not a trend. That's going to be the effort we're going to try to go through. I do acknowledge and appreciate, as we've worked with the universities down there, BYU as well as UVU, that they're sending out letters jointly, I think, to the students to tell them what they expect them to do and to see if we can't help them modify their behavior in a good way. So it's really all of us working together, as I've said. This is not me versus you. It's not the local elected official versus the business community. It's all of us working together. It's we, the people, doing all that we can in our respective roles to have a successful outcome as we fight this coronavirus, this pandemic, and stem the tide. So far, we've done a pretty good job. We can do better. But that's going to necessitate the cooperation of everybody to do the right thing for the right reasons. Thank you.
Thank you, Governor Herbert, Dr. Dunn, and Director Saunders. This will conclude our briefing. On Thursday is the governor's monthly KUED news conference, so that is the next time that we will talk to you. Thanks.